Neonatal Abstinence Syndrome, NAS, what you need to know. Every newborn deserves a healthy start, but for some, their first days are spent battling withdrawal symptoms. This condition is called Neonatal Abstinence Syndrome, or NAS. But what causes it? What symptoms should parents and doctors look for? And what treatments are available? Stay tuned as we break down everything you need to know about NAS in this important video. What is Neonatal Abstinence Syndrome, NAS? Neonatal Abstinence Syndrome, or NAS, is a withdrawal condition that affects newborns exposed to certain drugs during pregnancy. It most commonly occurs due to opioid use by the mother, but other substances can also contribute, including opioids, heroin, fentanyl, oxycodone, methadone, benzodiazepines, Xanax, Valium, antidepressants, stimulants, cocaine, amphetamines. These substances cross the placenta, affecting the baby's development. Once born, the baby is suddenly deprived of the drugs, leading to withdrawal symptoms. Symptoms of Neonatal Abstinence Syndrome. Symptoms of NAS usually appear within 24 to 72 hours after birth, but may take up to a week to develop. The severity depends on the drug used, the duration of exposure, and the baby's overall health. Common symptoms include excessive crying or irritability, tremors or shaking, difficulty feeding and sucking, stuffy nose and sneezing, vomiting or diarrhea, skin irritation, or sweating. Severe symptoms may include low birth weight, seizures, breathing problems, extreme difficulty in feeding. Doctors carefully monitor newborns for these symptoms, using standardized scoring systems to assess their condition. Diagnosing NAS. How do doctors confirm it? To diagnose NAS, doctors use a combination of clinical observations and laboratory tests. Finnegan Neonatal Abstinence Scoring System. This is a scoring system used to track symptoms and their severity. Urine or meconium tests. These detect the presence of drugs in the baby's system. Monitoring feeding and sleep patterns. Doctors observe how well the baby eats, sleeps, and responds to care. By combining these tools, healthcare providers determine whether a newborn requires medical treatment. Treatment and care for babies with NAS. The treatment for NAS varies depending on symptom severity. Some babies need only comfort care, while others require medication-assisted treatment. Non-medical treatments. First-line care. Skin-to-skin contact helps regulate the baby's body temperature and heart rate. Frequent, small feedings prevents dehydration and helps weight gain. Quiet, low-stimulation environment reduces irritability and stress. Medical treatments for severe cases. Opioid replacement. Therapy. Small doses of morphine or methadone help wean the baby off dependence. NICU monitoring. Required for babies with breathing or feeding difficulties. The goal is to keep the baby comfortable and support them through withdrawal safely. Prevention. How can we reduce NAS cases? Preventing NAS starts with proper prenatal care and early intervention for substance use disorders. Prenatal care, regular doctor visits can help identify and manage risks. Medication-assisted treatment, MAT. Pregnant women with opioid dependence can receive safe alternatives like buprenorphine. Counseling and support programs. Therapy and addiction support groups can help expectant mothers reduce drug use. Finally, Neonatal Abstinence Syndrome is a serious but treatable condition. With early medical care and prevention efforts, we can help newborns get the best start in life. If you or someone you know is struggling with substance use during pregnancy, seek medical guidance immediately. Help is available. Key takeaways. NAS occurs when newborns experience withdrawal from drug exposure in the womb. Symptoms include excessive crying, tremors, feeding difficulties, and irritability. Treatment involves comfort care, medication, and NICU support when necessary. Prevention starts with proper prenatal care and addiction support programs. Found this video helpful? Like, comment, and subscribe to Pharma, and gifts for more health-related content. Resources and more information. CDC, Neonatal Abstinence Syndrome. March of Dimes. NAS information.